No more cuts! No more cuts! No more cuts! No more cuts!
More than 200 people came here today to protest the closures of 3 state psychiatric hospitals. And these closures are particularly horrible because the state has no plan for providing services to the community.
State hospitals serve the most vulnerable patients because we serve those who have exhausted their private insurance or are uninsured. So basically we're kind of like a last resort for them to get treatment. So if we're closed, where would they go?
So you may or may not know, because the mayor has been real quiet about it, but it's not just the state, as Mark just mentioned, that's cutting. The city is also trying to close half of its mental health clinics.
More people that are not receiving services are going to be out in the street with their symptoms in full bloom, so to speak. And that creates a crisis situation, makes it more dangerous, and it actually continues to propagate the stigma that's attached with mental illness. Where people have this idea of people with mental illness being violent and committing crimes. And if they don't get the treatment, yes, that's what they're going to do. But I'm living proof that treatment works.
We have never fully funded our community mental health system. We don't have enough of them. We don't have enough staff. We don't fund them at an adequate rate, and so people often have to wait weeks or even months to get services in our community mental health providers.
All right, so I've given you 3 figures. Cost of care in the community, about $25 a day. Cost of having someone in jail for a day, about $70 a day. And the cost of having someone in a hospital, about $500 a day. Okay, now, if you're a budget guy and you're a bean counter, where are you going to really want people to be? You're going to want them to be out in the community getting the lowest cost, okay, the lowest cost of treatment. But isn't being out in the community also better? Yes, because you can have a life, right?
What do you think are the political motivations behind this plan?
It's just a shortage of money, and partly that we're not the squeaky wheel. We need to have a louder voice. And I think that the political calculation is that we don't vote enough, and we need to start voting more.
I had a state legislator, a state member of the state house, tell me that if she got 2 letters from her constituents on a particular subject, that told her that was an issue she should pay attention to. 2 letters. She said if she got 10 letters, she thought it was a big deal, and then her constituents were all fired up. National figures are about 6% of the people have a major, persistent, serious major mental illness. So that means that we're talking about, 6,000 to 7,000 people in every state legislative district, state house district in Illinois with a serious mental illness. So if those people and their families would go talk to their state legislators, they would be deluged.
But I'm telling you that no matter how sick we look, no matter how bad the symptoms are at any given moment, we can get better. And if we can do it with your help, we're not going to be satisfied until we have a system that everyone gets better at. The state says that the expectation is recovery, and we're going to make them keep their word.
Treatment works! Treatment works! Treatment works! Treatment works! But you have to get it. You have to be able to get it.